in a sea of allegations from Dominic Cummings yesterday, that was the one that stood out the most. And while the government has been careful not to give a kind of a line-by-line rebuttal of his allegations, that one obviously could not be left unchallenged. Boris Johnson was asked about it today, whether it was because of his inaction. His answer was no, I don't think so. But in an effort not to absolve himself of blame altogether, he did point out that at the height of the pandemic, there was an incredibly difficult series of decisions, he said, none of which we've taken lightly. But one of the difficulties for Johnson's government is that there is plenty of evidence for so many of Cummings' claims. In many ways, Cummings was just confirming things which were reported in the newspapers at the time. On that allegation in particular, it's made all the more uncomfortable for Boris Johnson by the fact that a former scientific advisor to the government was speaking just today. And he is someone who has in the past said that each week of delayed lockdown back at the climax of the pandemic, or at the beginning of the pandemic back in March of last year, each week would have cost us 20 to 30,000 lives. He was asked about that again today, and he said that he stood by that analysis.
Now, Tig, Dominic Cummings also accused the Health Secretary of lying to people. Matt Hancock has been speaking to MPs in Parliament today. What did he have to say?
Well, he denied lying. He said that he'd always been straight with people. He's accused not just of lying to the general public, but even to his cabinet colleagues too. Now, again, he did not give a line-by-line rebuttal of Cummings' many allegations about him, but rejected them in the overall. Have a listen.
Unsubstantiated allegations around honesty are not true, and that I've been straight with people in public and in private throughout. Every day since I began working on the response to this pandemic last January, I've got up each morning and asked, what must I do to protect life? That is the job of a health secretary in a pandemic. We've taken an approach of openness, transparency, and explanation of both what we know and of what we don't know.
You can hear Matt Hancock there, casting himself as a hero of the pandemic, not the incompetent actor that Dominic Cummings suggested he was yesterday. The problem here, yet again, is that there is plenty of evidence that things that he said were in fact untrue. One case in point, a piece of government spin about how they looked after older people in care homes at the peak of the pandemic. Matt Hancock talking about there having been a protective shield around care homes, whereas we now know in reality that older patients were discharged from hospital into care homes without having taken COVID tests, many of whom went on to infect other patients. Now, for Boris Johnson, for his boss, he can point to recent elections here in England and the handsome performance by the Conservatives as proof that the general public isn't much moved by these allegations because they have been in circulation for a long time. The problem for Matt Hancock is that with these allegations resurfacing again, he, as a cabinet minister, is much more expendable.